bright, isn't it?
Yeah, it is bright.
Hi. Good to see you.
Welcome to the ARCO Forum at the John F. Kennedy School of Government. Tonight is the first forum in a year-long series of forums, speeches, brown bag events on the crisis in America's families. Tonight we're going to start looking at the role of government. It seems somewhat fitting after the last election that someone should be debating and evaluating the role of government in families and children. America has been conflicted for a long time about families. It has provided enormous support to families. There's not a single family in this country that doesn't have ongoing support from the government, from the federal level, the state level, and the local level, as well as support in times of crisis. But at the same time, we guard very carefully the privacy of the family. We worry a lot about when we should intervene in families if we think things aren't going right. And in fact, we have a very hard time sometimes defining what it means to be going right or what it doesn't mean to be going right. Part of the campaign in the last election dealt with family values. It's not clear yet that we've come down with a sense of what these values are, but they're very much in the public discussion and the public debate. And tonight what we want to talk about is what government can and should be doing to help families and children, and how the various levels of government can work together to make families work better. We have three panelists representing different levels of government. Our first speaker is going to be Jo Bain, who is well known to many people in this crowd. She's currently the Assistant Secretary for Children and Families at the Department of Health and Human Services. That means she's responsible for about 60 programs. She's going to tell us about quite a few of them in a few minutes. But Head Start, aid to families with dependent children, child support enforcement, a large number of very important programs. She went to Washington from New York State, where she was the commissioner of the Department of Social Services. Social services in New York State is public assistance, support for children and families, support for adults, Medicaid, aid to the Indians, aid to the blind. It's half the state budget, I think, or pretty close to that. So she was a key player there as well. Before going to New York, she was here. She's the first woman tenured at the Kennedy School of Government and the first director of the Malcolm Weiner Center for Social Policy. Jo has written a lot of books, articles about the characteristics of families, the programs that families are supported by, about management, about how families and individuals use these programs. She's covered the whole area. And so tonight we want her to tell us what her latest thinking is and how she thinks government can help families.
Thank you. It's really a pleasure to be back and to see so many old friends and some new friends. Washington's a pretty interesting place these days. The morning after the election, I called my senior staff together for our normal Wednesday meeting, and it's a fairly large group, and half career and half political, and we were kind of trying to figure out what this was all about and what it meant for the agency and what it meant for us personally. And one of the members of the staff kind of raised his hand, and he said, here's what I've been thinking. He said, when I was 22, he said, I found myself in Vietnam in the middle of the jungle, a soldier trying to report on the Vietnam War. And he said, at that point, he said to myself, what am I doing here? This is terrible. But he said, after a while, he said, I realized that where else should one be? Where else is the center of the excitement? Where else is the challenge to learn and really do something but being there? And then he paused and he said, I'm not quite sure what the analogy is between that and this, but it feels like there is one. But it is an exciting place these days and a lot of challenges and a lot to do. I'm actually going to talk a little bit about some issues that have crossed the various pieces of my life. I feel like I've been extraordinarily lucky in being able to work at the state level, at the federal level. In my earliest incarnations, I actually taught school and did something useful at a community level. And as I try to think, both as an academic and as an administrator now, about what services really mean, what change and reform really mean, what the role of government in providing services and serving families and children really means, I find myself going back and forth between the various pieces of my life. When I was commissioner in New York State, I spent one night with a pair of child protective workers who worked on the Lower East Side in New York City and who responded in a 24-hour-a-day manner to crisis calls that came in to the child abuse hotline reporting on kids in trouble. And I went out with the two workers. There were two of them, I think, because they had the state commissioner in tow, and they wanted to make sure that they could handle it. But I went out with them to a call that had come from a Hispanic community, Hispanic family on the Lower East Side, and we went to investigate the complaint and talk to the family, and it was clear that the family had lots of struggles that it was engaged in, economic struggles engaging the community, learning the language, dealing with the children, had obviously a couple of rather difficult children, one child with a number of medical problems about whom the call had come. But the job of the child protective workers was to respond to this complaint about abuse and neglect. And as I kind of was with them during the night, kind of got a sense of what it really means to try to cope with some of these problems as a worker at the community level in a system like that in New York. And as the evening went on, I got the feeling that these two guys had just about the hardest jobs of anybody that I'd ever worked around with, because they were being called upon to make judgments. Would they remove the child from the home? How would they deal with it? How could they handle getting the family to the hospital, getting the child taken care of? Did they have to take the child into custody? How could they help the family understand what was going on? They were about 25 years old. They were paid about $22,000 a year, and they needed to make these decisions. And as the evening went on, it became clear that although at each point along the way they were making the appropriate decisions according to erring on the side of caution, trying to be careful in the decisions they make, it became very clear that the outcome was going to be wrong, that the outcome was going to be one which was not, in fact, supportive of that family or the child or the community that they were living in, but that they were doing the absolutely very best job they could. They were doing what we as citizens would have wanted them to do at each point along the way, whether it was kind of calling the police to help intervene with an angry father or whatever, but that the outcome was wrong. And that evening made me realize a couple of things. One, that they had a lot harder job than I did, and that I admired them enormously for it. But it also made me realize that if we are to think about reforming or changing services to families and children, we have to keep remembering that reality, the reality in which that family was living, the reality of a worker in that situation having to make those decisions, the reality of a limited number of options available to them, and a limited set of skills to deal with them. Now, you can imagine, and I have seen, instances in which interventions at the local level have been much more positive. Interventions in which a worker was able to help a family come together, figure out how to deal with a difficult child, how to deal with a difficult situation, how to avoid confronting the child protective bureaucracy, avoid confronting the decision over the placement of a child. Centers in communities where families can come when they're in trouble, when they can come and say, I'm having a lot of trouble with my kid, can you help? Can we all work together and help? We can see those kinds of things. But again, when you think about what change or reform really means, what it means is a kind of set of pictures you have about things that go on at a very local level, a set of interactions between a family and a child and a worker who is working in an institution with a supervisor and a set of rules to worry about, and in many cases a family of his or her own to think about. So one vision of reform or change that you have to have in your head is the vision of something different going on at that very concrete level where things come out better for an individual child and an individual family. Shift now to Washington, D.C. What does reform mean in Washington, D.C.? Well, by and large, reform in Washington, D.C. means passing a law. It means passing a law, for example, that Congress passed in the summer of 1993, the Family Preservation and Support Law. This was a law which was proposed by the administration, passed by Congress, to respond to perceptions of some of the kinds of problems that I've just described that you can observe at the community level in child and family services. It was designed to speak to the need for more preventive services to keep families out of the child welfare system, for more tools in the toolkit of the worker on the street, for more support for families in that way. It was a law which has a quite lofty preamble. It provides some money, it provides some guidelines, it asks for state planning. Congress passed it by large margins. The president signed it. Everybody was happy. We had a party, and Congress thought they were done. Now think about how you get from here to there, because that's the problem of providing public services. That's the problem of managing. That's the problem of thinking about the role of government in providing services to families and children. How is it that something that Congress passes and signs and thinks it's done with then affects in some way the interactions that take place on the Lower East Side of Harlem between a New York City child protective worker and a family? The kind of traditional approach to implementation, to public policy, is one which says, well, what you do is you take this law that Congress wrote and you write a set of regulations and you specify things that government should do. You put in place a set of accounting procedures, you write a set of instructions, and you, at the federal level, mail them, or now we, of course, email them, to the people at the state level, instructing them in things that they were going to do. I've now had a reasonable amount of experience, both at the state level vis-a-vis counties and at the federal level vis-a-vis states and localities in mailing out directives. This can actually be a quite satisfying experience because you feel like you've done something, you've done what you are supposed to do and what you are paid to do. But I did have the unfortunate realization that the directives that I send out don't always bring about change in what people do, and certainly don't often in productive ways get themselves translated down to what I really care about, what goes on at the community level. And so one of the things that we have tried to think about as a team in the agency is, what are the things that we at the federal level, which is very far away from the child protective worker on the Lower East Side of New York, can do that might actually help to bring about change in those interactions. And of course, the important thing to remember is that there are hundreds of thousands of those interactions taking place every day. And of course, the child protective system is even one of the smaller ones. And so what you are kind of trying to think about when you think about the role of government is, what are the ways that you at the federal level, you at the state level, you in other kinds of positions can provide the kinds of leadership that might actually somehow make its way down. And I sure don't think that we, or probably anybody, has come up with a lot of really good answers, but it has been my experience, at least, that if you if you try to think about it in that way, if you try to think about where it is that you actually want to bring about the change in behavior, the change in results, and then think about where you are and what's in between and what are the things that you have some influence over. And I think in many ways control is the wrong word. Have control over almost nothing, as best I can tell. But you do and can have influence over a lot of things. And one of the insights of one of the people who worked for me, another Kennedy School faculty, by the way, Olivia Golden, who's now in charge of this area in my own agency, was that one of the main things we had to do at the federal level was try to do everything we could to change the climate around children's services, to change the way that people thought about it, to change the kind of attitudes that were in their heads when they went out to work every day. And so she figured out that the process of writing regulations, which we had to do for some reason, we always have to write regulations, that the process of regulations could provide us with a vehicle for helping bring about a change in climate, a change in attitude. She structured it through an extensive consultation process. I used to tease her. She was holding, I don't know, 5 focus groups a day with all manner of people in all parts of the country, and using our various staff to do it. And you'd kind of say to her, you know, Olivia, you know, aren't you getting more input that you can use? How is it that this is actually going to influence the writing of the regulations? To which, of course, her answer was, I don't care about the regulation. What I'm trying to do is use this process as an educational device, as a way to change attitudes, as a way to get people thinking in different ways, as a way to get people focusing on what goes on in their community at the local level, and that by getting them involved in this, I will bring that about. Also tried to think about a set of strategies that would indeed stimulate a planning process at the local level, which would involve the federal government, the state government, people at the local level, the people who do the work, and the clients who work on the services, and to use a planning process to think about how you could bring together a variety of services. I mean, one of the things that I think everybody realizes when they work in children's services at all is that you can't possibly, with a set of government programs, meet the needs of families and kids. I mean, you can't possibly do it. You can't possibly have enough resources under your control in government. You can't possibly have always the right set of things. But when you look around a community, you can see that many, many more resources are there. There are businesses, there are nonprofit organizations, there are churches, there are extended families, there are all manner of people doing wonderful and important things who are available to supplement the things that government can do. And I think another insight about how you get from here to there, what the role is that one might play at a higher level of government, is that you think about the role of mobilizing a larger set of resources, not only bringing about a kind of change in how one thinks about providing services, but trying to bring together and to mobilize the broader range of resources that people have available to them to be able to provide help to children and families. And that actually is something that federal leadership can help bring about, that state leadership can help bring about, to bring together resources to bring out the best in people, to mobilize a community to see that it has a problem and that it, in fact, needs to adapt, pull together, and to provide some of those services. The third kind of leadership that higher levels of government can provide, and again, it's not a brilliant insight, but I think an important one as we think about it, is that that government, especially the government that's providing some of the money for this, can ask for reports and can ask for accountability measures that can either very much get in the way of good services going on, or can actually be helpful in providing good services and bringing about change at the local level. It is always kind of startling to me to realize how much the existence of a reporting mechanism or the existence of an accountability mechanism actually influences what people do. because it turns out that you do indeed get what you measure, as we observe in many cases. And if you get it wrong, you can have some pretty perverse effects. So that if you measure, for example, the number of children placed, you get more placements. If you measure the number of reports filed, the number of cases dealt with in a certain period of time, you get the cases dealt with, but you don't always get good services. And that's a very big challenge, and I think other people on the panel will want to think about that too, to try to structure mechanisms, reporting mechanisms and accountability mechanisms in ways that reflect, that help change what actually goes on at the local level. And again, these are not things to be written in statute. These are not things to be written in regulation. These are things to be done by leaders in various positions in and out of government who are interested in bringing about change. Let me just spend a few minutes more here talking about reinventing government, because I think that the challenge of reinventing government is a serious one, and it is not just the challenge of cutting down the number of bureaucrats or cutting down the number of minutes that you have to stand in line at the Bureau of Motor Vehicles. Reinventing government, and I think we must do it. I think that part of the message, much of the message about the election was a message which says, when we watch what you guys do, we don't think a whole lot of it in a lot of occasions. We think that you spend too much time being too bureaucratic. We're not sure you're making good use of the resources that we're providing you. We think that there need to be some serious changes, and I think the challenge of reinventing government is the opportunity that we have to respond to some of those messages. But what does it really mean? Well, I think it doesn't mean kind of streamlining. It doesn't mean many of the things that we often talk about. What it does mean, though, is changing a culture. It means focusing on results. It means conveying a sense of urgency to all the points of government and all the service delivery points about the fact that there are people out there with important needs which we have some obligation to help meet and some ability to help meet. I mean, one of the things I find myself doing a lot in my own job is telling people to hurry up, please. Now, political appointees, of course, have notoriously short time frames, and there's a good reason for that, as we find out periodically. But it is all too easy in government, and especially in the career parts of, to let things take way too much time, to not feel a sense of urgency about the problems that are there, about the results that we need to achieve. And I think what reinventing government needs to do is indeed changing cultures. It's focusing on results. It's conveying a sense of urgency about the importance of the mission that we are carrying out for the people who have asked us to do it. It also means, I think, examining all our activities. One of the things I keep saying in my agency is that we need to spend more time helping and less time watching. People in government spend a lot of time watching what each other does and checking it and making sure that it's right. And to bring about a genuine change in government, we need to work real hard on making sure that the people who are actually working in government work. There's one of the parts of my agency is actually responsible for the AFDC program, and there are parts of that agency which have become a little sleepy over time, and I now tease the agency and its director that we're imposing a work requirement on the people who work in that agency, and I think it's actually a kind of useful thing to do. But it is, I believe, incumbent on us to examine all that, to really examine what we're doing, to realize that we have scarce resources, we've got to be doing the work, we've got to be helping, we've got to have a sense of urgency about the mission, and that has to get through all the levels of government and all the service providers, or we're not going to be able to do anything for kids and families. And I think finally what reinventing government means is that leaders have to try to think about what they do. Leaders set the tone. Leaders don't always do all the work. Leaders send the message, and leaders take the blame. Because when people are empowered to do things, when people are empowered to do work and to do it fast, to do it with urgency, there are going to be mistakes that are made. And those of us in government who are more trained to avoid risks and keep our names out of the paper than almost anything else, sometimes set a tone in our agency that the most important thing to do is avoid mistakes. And I think one of the hardest things for me and others have learned is that we have to be willing to have those mistakes happen, and we have to be willing to take the rap for it. That's part of the deal. That's part of what we get paid for. And as part of bringing about a change, bringing about a set of activities at the federal level and at the state level that might actually have the chance of bringing about something better for families and kids when they interact with service providers and child protective workers at the neighborhood level, I think that's what we have to do, and I think that's what we're about. Let me now turn over to others and then go on with the discussion.
Our next speaker has some good ideas about how the federal government can be less watchful and more helping. Linda Carlisle. Linda is the commissioner of the Massachusetts Department of Social Services. She's been here almost 2 years now. She came to Massachusetts after a several-year stint as Assistant Deputy Commissioner for Policy and Planning at the New York City Child Welfare Administration, where she gained a reputation, as one of our alums said, of being a manager's manager. When I talked to Linda shortly after she came, she said somehow Massachusetts looks a lot more manageable than New York City. So we're going to find out tonight if this is true. The Massachusetts Department of Social Services had experienced a turbulent several years before Linda arrived. Governor Weld commissioned a blue ribbon panel to conduct a detailed review of the department and to recommend a wide variety of changes. The report of that panel and Linda arrived at about the same time. Linda took the report and, with a great deal of ingenuity and hard work, implemented the major recommendations and has begun to turn the department around in the eyes of many people who follow it closely. Her goal has been to support those practices that are effective, to change those that are not, to increase accountability, and to reward productivity. But all the while, she's kept her eyes on the children and families of Massachusetts. She's been very focused on this vision. And for those of you who are Kennedy School students who might have wondered what you do with a master's in public administration, well, Linda has a master's in public affairs and administration from Columbia, and we'll hear from her now.
Great, thanks. I came here, as Julie said, from New York City with a fabulous Blue Ribbon Commission report, a promise of $20 million on top of my base 93 budget. And what really intrigued me was the same thing that intrigued me in New York City after the death of a small 6-year-old girl named Lisa Steinberg, when they started to put together a new team and hired the 5th commissioner in 3 years at the Child Welfare Administration. I was faced with a department with low morale, stories on the front page of the Globe and the Herald and the Evening News, no support in the governor's office. In fact, when I arrived, most decisions were being made out of the governor's office, and no respect in the legislature and the advocacy community and the provider community. And the staff were beginning to behave like abused children themselves. They were beginning to believe all the bad things that were said about them. And I said, God, this sounds great. If nothing else, I can't screw it up. So I'll talk a little bit about my perspective as a state person, and it's very different from the relationship we had in New York State, where I came from, where Mary Jo would have been seen as the enemy because she was the state SDSS commissioner, and we were at the Child Welfare Administration, and on a daily basis we had the kids, and the bureaucrats at Albany had nice, easy lives and just made impossible regulations, and then came in and sanctioned us and fined us for not complying with them. So it was really a pleasure coming to New York City, or to Massachusetts, where I'm both the city and the state. So if we don't like a regulation and we find that it doesn't work, we just change it. And that certainly makes life a lot easier. I also realized a very important lesson in my job in New York City, where we were all summarily asked to leave in the transition from Mayor Koch to Mayor Dinkins, that there's a life to these jobs. In fact, on a national basis, there's about a 2-year life of an average DSS commissioner anywhere. So having been fired, it kind of made me feel free to do what I thought was right. I mean, I know at some point there's going to be a dead child and I'm going to be fired. I mean, that's just kind of the way it goes. So it really does free you up to do what you think is the right thing. No one certainly goes into a business dealing with children and families in a government position, either the one that I have or that Mary Jo has, because you're going to get rich, famous, become popular, any of those other things. You go into it because you really like feeling like you get up and go to work every single day, knowing that you can make some kind of a difference, or hoping you can. And what's really nice about a job like this one in Massachusetts is that on the highest level you can think about things like, how do you define risk to kids so that those child protective workers who go out on that front line to go up to that crack cocaine mother's door in the Lower East Side and have to make an instantaneous decision about whether that child is at such risk you need to remove them on the spot. Those kind of decisions you have to make systemically. Now, I mean, in the commissioner's position, you have to kind of think about the federal regulations, the federal policies, your state policies. You have a lot of different constituency groups. But then you get down to the actual cases. And on the way over here tonight, I was on the subway from South Station to Harvard Square, and I was reading a child fatality report about a little 9-year-old foster girl that died unexpectedly of a supposed heart attack in October. And when the report came in of that girl, and there's some other things behind the case, even though I've got 22,000 open families and about 70 deaths a year, on Saturday when I was talking to my press secretary and we were managing the Globe and the Herald reporters that day, I got off the phone with her and went in the bathroom and threw up and started crying uncontrollably, because every 100 or so cases you can't help but get to you. So you kind of go from that big picture world of policy and regulation down to something that actually happens to an individual kid, and it makes it very, very, very real to you. When Mary Jo was talking about managing the reinvention of government at the federal level, that's something that we struggle with at the state level too, is exactly how to do that. And I feel very strongly that it's important to have sound business practices. The good management should be in the public sector as well as the private sector. And so what we've tried to do is to establish that kind of accountability that Mary Jo was talking about, and to work with the staff of the agency to develop a series of management plans where we've got key performance indicators, about 20 of them, that the staff help to develop and set the performance targets, and we go out and measure those. And those are things that we would say, if you aren't doing these with the families that you're working with, then why are we involved in their lives? Did you do a timely investigation of the child abuse or neglect report? Did you do your home visit? Did you see the kids every month? Did you see the parents every month? Did you visit the foster parents and make sure that they were licensed? So there's a whole series of things here that we're trying to do. And we're reviewing all of our cases on a quarterly basis. Something that I think is really interesting is that the caseworkers on the front line see the fact that we have a supervisory review of each of their 22,000 cases every 3 months as a needless exercise in more paperwork. What I see it as is ensuring that a supervisor is looking at every one of the 22,000 cases, and I know that it's open for good reason and is getting appropriate services. What we also know from that report, it's called the Progress Supervisory Review, is that there are what are the barriers to actually moving this family on to another level, to some kind of success, either reunifying the family, either terminating parental rights, whatever the goal is for that family, to make sure that they, A, have concrete goals, and B, are making some progress to those goals. So we've developed a barrier section so that every 3 months the supervisor has to fill out what are the barriers to moving this family on. And from that we've been able to see that some of the barriers may be lack of adequate housing or lack of appropriate medical insurance, or we need to get a court date to dismiss custody, whatever those barriers may be. And we've been able to now take that on a statewide basis through our computer system and actually go tackle that. We've been able to take that information about the housing issues and go over to the housing agency and get Section 8 housing vouchers by name for each of those families. We've been able to go to the Division of Medical Securities in the state, which has a program of universal health coverage for kids under 12, and we've been able to by name, by family, go over and say, here are families that we need to get some health care for. So it's been enormously helpful. But in order to do that, when I got here, I didn't get the $25 million I was promised. In fact, I got whacked by $20 million. So I started out $20 million in the hole. We spent about half a year trying to get back to go. So you have to learn that you can't be everything to everybody. So in addition to defining what our accountability measures were, we defined what our mission was, and some people would say that we narrowed it. In terms of the public policy around kids and families, key state legislator, who I will go nameless, said to me when I went in and asked him for more money to support our budget last year, said, well, with Clarabelle Ventura out there, you know, and all your families looking like that, what difference does it make whether you've got a caseload of 18 per social worker or 30 per social worker? I mean, aren't I just pouring money into this big black hole by funding your agency? So I thought that was very interesting because according to him, you know, in his mindset, he could put the money into roads. He could put the money into things that people could actually see the benefit of, more cops on the street. But to put it into more child protective workers out there on the street with families who are really severely damaged, what difference was it going to make? So what we have tried to do is to kind of turn that situation around and say, if you've got established accountability measures and you can kind of prove some success, then you know, that's why you need more workers. We were able to make a 40% increase in our adoptions this year, get permanency for that many kids because we were able to do some good work. So by demonstrating success, we've been able to I think, do pretty well in terms of the budget work. Switching a little bit to another subject quickly, the other thing, when Mary Jo was talking about those frontline protective workers, I was thinking one of the most influential books that I've read for my job has been The Forest Ranger by Herbert Kaufman, and I reread it when I took this job. And for those of you who don't remember it, it talks about the Forest Service and how do you manage something that's got both the Adirondacks and the Grand Canyon and the National Seashore. And I feel that way because I've got the Cape and the Berkshires and Roxbury. And so it's important to kind of figure out how do you establish policies and procedures that can apply as well to one area as it can to another. He also talks about the need to support the operative level employee, that frontline employee. So I think that a modern bureaucracy should take that old pyramid-shaped government structure and turn it on its head. And so I'm forever going around the state saying that our job at central office at the statewide level is to support the frontline workers and that we should really be at the bottom of this inverted pyramid. So that's what it's like kind of working from my perspective. Now when it comes to the feds, well, I told Mary Jo before we came in, I have been very pleasantly surprised in terms of the relationship that we've managed to build with the federal regional office here in Boston, and much to my surprise, they have been very supportive of many of our actions. I really thought I had to kind of have a healthy skepticism about what it is that I told them and didn't tell them that we were doing, but that's dissipated somewhat in that where we have found common ground on initiatives, we've found that the federal administrators here in Boston have been willing to do things like fly to Washington to talk to other people at HHS with us to cut 14 months off of the time frame of a new computer project. I have been able to use them to beat up on us, to tell us to get to do stuff that I wanted to do anyway, but needed them to tell me to do, which is a really useful. But in terms of then there are other initiatives that come along when I feel like, oh my God, I've got my plate full, I've got my agenda set, I know exactly what I'm doing. Why don't you just leave me alone and go away? Give me the money and go away. And one of those areas is the Family Support and Family Preservation Act, which I feel like for $1.99, you too can change the face of government. Sorry. The frustration, I mean, we're all in agreement about the goals of the Family Support and Family Preservation, in that we really want to affect the way that families and children get treated, so that you have a range of programs out there on the front line, so that people don't need to get in through that abuse and neglect reporting front door. That we call it the 51A front door in Massachusetts, but that there are places out there that families can go if they're stressed out, if they need help, and we all do it. What I found is that for that, in Massachusetts, about $5 million over 3 years' time, every advocate in the world has come out and wanted to try to figure out ways to change the boundaries of state agencies and rewrite the organizational structures. And my view of the world is that if we start concentrating on changing organizational boundaries between established state agencies, we're never going to get money out there to communities to work with families and kids. And so I've been trying to control what has become for me, and it's my fault, the planning process from hell. Well, we've got 200 people representing absolutely every variety of folk known to the Commonwealth, all with that many agendas in the room, and to try to see how do you get it down to the level of people who can work with kids and families and have a planning process that's meaningful for them, rather than being driven by the agendas of people who would like a slice of the pie. And that's been a very tricky thing indeed. So we've tried to do some things that are creative. And actually the HHS people have been incredibly helpful and supportive of that. So that's kind of tough in that whereas there's a limited amount of money and folks at the federal level would, rightly so, I would want to do the same thing, affect change at the local and state levels. The money in it isn't enough to really do it in a wholesale way, plus there's money coming out of various departments at the federal level that are saying similar things, and they sometimes come at cross purposes. But what I think is really nice about working at my level, and what I enjoyed about New York, is the same thing Mary Jo talked about in the beginning, is that you're really close to where the action is, and that you get to try to do something about those little kids that die, and about the child protective workers who are very lowly paid and have some of the toughest jobs in the world, and to try to do what you can to kind of really make a difference for kids and families. So, I think it's kind of nice that we're all trying to work together on this stuff now.
We've purposely selected a panel to represent all levels of government. Our third speaker is George Latimer, who is another committed public service who has done it all. Latimer is a lawyer who practiced law in St. Paul, Minnesota, until his election as mayor of that city. He was re-elected 5 times and served a total of 14 years. While he was mayor, the city of St. Paul received a large number of awards, including the All-American City Award, the U.S. Conference of Mayors City Livability Award, and the Presidential Award for Design Excellence. So he clearly knows what he's doing in managing a city. Latimer then retired from the mayoralty and went to Hamlin Law School, where he was dean. We don't know how the course of history might have been changed had he been named provost and acting president as well, but he wasn't. So he abandoned the quiet life of academic administration for service in the federal government. Secretary Cisneros appointed Latimer to head the newly created Special Actions Office of HUD in July of 1993. This is an office that serves as a catalyst for creating non-traditional partnerships to address the needs of urban and rural residents in America. Thus, Mayor Latimer has been an influential actor on both the local level and the federal level on a range of issues that affect families and children.
Thank you very much, Julie, and ladies and gentlemen. It's good to be back to the Kennedy School. I always learned from Mary Jo Bain, and I was prepared to learn from her But then I was really startled to see the other panelist came to St. Paul so many years ago. I think she was under 30, and the mayor there had a full head of black hair. And she reformed the civil service system of St. Paul, and things have never been the same. I left immediately after that. So it's great to be back with Linda also. I'm going to take my 5 or 10 minutes to give you a mayor's perspective, or a local citizen's perspective, because that's where I spent most of my career. It is my delight to work for the person who is far and away the finest public servant I've ever worked for, either elected or appointed, Henry Cisneros. It is nice, however, to be here on my own account. I often am called to pinch hit for him, and it's not fun because larger crowds than you have awaited Henry Cisneros, who is a tall, elegant, and eloquent man, to be met by me. And for me to look out at all those jaws dropped to the floor gives me a whole new meaning to the phrase lowered expectation. So it's good that you got Mary Jo Bain. That was promised to you, and I can run free form. I make no pretense at this late age to try to speak for the Clinton administration, but I, having thought about some of these issues of poverty and joblessness and central city decay for close to 30 years, there is a consonance between where I am right now and the primary values of this administration, most certainly those expressed by Henry Cisneros. When you get into the HUD questions now, asking me about programs, I'm going to pass them off because we have the regional director here with us. Mary Lou Crane represents the entire region of New England on behalf of Secretary Cisneros. So don't get too relaxed, Mary Lou, if any tough questions come. We had a very active time between my years on the school board and mayor in St. Paul, about 20 years, grappling with similar problems through those years. And it's very sobering. It's sobering for this reason. St. Paul, Minnesota, which is, by the way, not Minneapolis. If you try to get that into your head, I'd appreciate it. I appreciate Julie acknowledging it by not calling me the mayor of Minneapolis. But as you know, the Twin Cities have earned a reputation as generally being well-governed, humanely governed, and a fairly civilized place. And I believe it is all of that. It's also a place where public-private participation and combinations have been at work for a long time, and it's also a field in the human service area, and I'm fortunately married to a person who's devoted her career to this in the foundation world, have tried just about every self-sufficiency and parenting and the best of the programs I think are occurring there. There is, in that experience, great hope, and also it's very sobering, and because of the importance of this occasion, I'm not going to try to sugarcoat the latter. In St. Paul, Minnesota, in 1980, we had an unemployment rate of anywhere from 4.5% to 5%. In fact, I doubt that our unemployment rate was ever over 6 or 6.5% during all those 14 years, 76 to 90. In 1980, the Census Bureau said that we were the lowest number of people under the poverty line of 50 largest cities, about 9.5% to 10%. Minneapolis is about 13%. Now, I give you these numbers for a reason. So we had about twice the number of poor people as we had people who were unemployed. Now, in 1990, after the legendary leadership of yours truly, in which we worked assiduously and I think intelligently on job linkage programs, BOSS programs, self-sufficiency, for offering a Section 8 certificate, a living opportunity for welfare mothers, in which we thought we would take 30 days to identify 200 applicants, got 575 applications in 72 hours, demonstrating again and again and again that people want to be self-sufficient It isn't something we have to teach them. We simply have to somehow create a system that really gives the opportunities that we like to talk about, but are too often not there. Now, because of the time limitations, I'm going to compress the experience that I went through, and I hope that you'll trust me that between the Job Corps and CETA and JETPA and several, we stole the Boston Compact program and the Lang, I Have a Dream, and we combined them. And with all the wealth of corporate and philanthropic support that we had there, that at the end of that period in 1990, the unemployment rate is now lower than it was. It's 3.5% today in the city of St. Paul. And the number of people under the poverty line has now risen to 18%. The number of people in Minneapolis unemployed is about the same. The number of people under the poverty line in Minneapolis is now 22%. And both on Bain or Elwood's or anyone's measurement of overconcentrations of poor, which I think is at the 40, if the percentage of people in the grid are represent 40% under the poverty line, it's overconcentration of poor. Those numbers are increasing in those two cities and in cities all over America. Now, I don't know how anyone, a Republican or a Democrat, I don't view this as partisan. And I personally think that this election should be the test for all of us to get together around some serious solutions. I left this afternoon at the Federal Reserve. The corporate community of Boston put together a program with a number of foundations and examined some 25 cities. And they came, and the findings will not be published until 1995 in January. But their findings are not remarkable, as I told the gentleman who headed it. The findings were not remarkable. The recommendations were not remarkable. What is remarkable is the people who found those findings. And if we don't get the private sector engaged with these issues, they will never be solved. And the reinvention we're talking about has got to mean some set of principles. And I will batten this down and skip an awful lot of stuff I would have liked. I'll probably sneak it in later. But I'd like to, I know that we want to be engaged here. Let me reduce my observation experience, and I will later, I will get into some things that Secretary Cisneros and HUD has been trying to do to shape, to move this great beast of HUD, and to shape its programs in a way that reflect the things that Henry Cisneros and you and I have learned over the years about what works for people, which are basic things like reciprocity and some opportunity for work at the end of the effort to get there, and like some participation engagement by shaping the environment that you live in, even if you're poor, and about making sure that children are as safe, even if they're poor, as if they were rich. That's the dream that we are pursuing. And I'll go into some small examples of reform perhaps a little bit later on. I'd like to just conclude, and this is just my list. I wrote down the things in listening to Mary Jo that I think goes to the reinvention, or goes to what works. The first, she mentioned, how do we get from here to there? And Leo XIII used the phrase subsidiarity, which is simply how do we get every system to be delivered at the level closest to the people being served? And it seems to me that's not a bad place to start. The second thing I wrote down, I don't like the word, but I don't know a better one, holistic. How do we get that family engaged around the abuse and neglect issue, rather than merely the regulatory and punitive ad hocing it, which so often our systems now drive us to do. I have the issue of race down. People are tired of talking about race, especially white middle-class people like me. Don't want to talk too much about race. I don't think that there will be a real peace and a real solution to the problems of America unless we identify race as an issue in addition to economics. William Julius Wilson attributes the rage of the black youth that he has studied to two things. And one is the lack of any serious economic opportunity, and the third, the rage of the obvious discrimination and conflict over race that has been with them since the first time they opened their eyes. And I think that's got to be put on the table if we're talking about neglect and abuse, if we're talking about engaging parents in their solutions, if we're talking about economic self-sufficiency or relative self-sufficiency, we have to deal with that issue. And I don't know what the last one was. Yeah, I put this last one here, actually, I'm ambiguous about, and I simply throw this out. I put down targeting. I spent the first 10 or 12 years that I was mayor fighting hard to make sure everything was targeted, that there not be skimming. That's shorthand for saying, make sure the service gets to the poorest of that population you're aiming to serve. Because there is a tendency in most of these programs, without malintent, of in fact, the people at the highest levels, the ones probably who need the help the least, are the ones most likely to have the opportunity to take advantage of it. So we have to face that. So therefore, I always pushed as mayor, and most liberal, and we can say that now, those of us who are not seeking election, but progressives in the 70s and 80s, generally focused on making sure we really target our services because we know the resources are so limited. I no longer believe in that. I believe that the politics of targeting are so devastating that the divisiveness that comes from targeting, that he gets it and I don't, and why is she getting it and we don't, and that kind of divisiveness, and the politics of that means that we lose any real unified popular support for programs that are needed for all of us. And secondly, from a policy standpoint, I think the distinctions we make between the poor and the very poor are tougher and tougher to make. And so we all know the rage about welfare. There are two people most full of rage about welfare as it exists. One is the women who are crushed by the system who are in it. And the second are the women who are working and are deeply poor and not able to make it at the end of every week. And so we know that the desperation cuts across that line. And so whatever system we dream up, and however well we swap back to the locals and the state and whatever else, I think the future should engage more and more of our people in graduated ways that don't label and target people for the programs. Those are the set of learning, kind of the things that I learned over the years. And I think, I don't know, Mary Jo, maybe the conversation will take us there, but I'm not so sure that if what we heard here tonight is accurate, I'm not so sure the present climate isn't as healthy to examine prime solutions and prime causes as ever. At least the issue has been joined, and so I say let's get on with it and stop trying to agonize about what the people meant. Because I know a lot of losers and they know what the people meant. And get on with making sense out of our massive resources. Thank you.
We'll now open up the discussion to questions. We'll take questions from the mics. While people are standing up, I'd like to ask the first question, and that's to you, George Latimer. If you'd like to move away from targeting in a time when resources seem to be dwindling, what's the alternative?
Oh boy. Having established myself as non-expert, I could, for example, we right now have a graduated daycare system. We don't call it that, but that's what it is in America, in many places. So that daycare, the cost for daycare for a working woman are astronomical. And if a woman is just getting a job for the first time and is making $12,000, $15,000, $18,000, not going to make it. But on the other hand, there are lots of women out there who are making $26,000, $27,000. It ought not to be either or. I'll defer to the two people here, Linda and Mary Jo, but I do think that the European system, when I was in Bologna, I saw daycare that was not provided based on only income. I think in France they do the same. So I think it's workable. The main thing is to commit to it and then get the private sector involved in the delivery of the service and work out the economics of it.
Mary Jo or Linda, do you want to?
Well, the question of what's the alternative is the right one, especially what's the alternative when you don't have the resources that you need to serve everybody. There actually are, though, I think, successful programs that one can be pleased and satisfied about that do target pretty tightly. The Head Start program is my, and I suppose everybody's favorite. It is a program for poor children. Head Start centers are located in poor neighborhoods and serve low-income families. They're very good and they're very important. And if we had to spread that money over all 3- and 4-year-olds, you wouldn't be able to deliver the kind of quality service that you can by focusing it in poor families, in poor communities, and on poor families. So I think the issue is the right one, and I think that it's always a set of choices about kind of what you can do and how you can get the most effect for what you can do.
Linda, if you want to jump in. Okay. Please just state your name and your question.
Okay, my name is Nora Huddick. I should probably confess from the outset that I'm a child protective social worker. I was wondering about one of the biggest obstacles that confounds me in my job is the natural tendency of people not to want to deal with the issues of abuse or neglect. And that shows itself in the public views of our agency, in that the public and service providers in general tend to bash the agency, and then on the other hand expect us to do anything and everything. And it also reflects on how the state government sees our agency, or how the agency itself sees itself, in that frontline workers tend to get portrayed at times as lazy. Because things aren't getting done, it's because frontline workers are lazy. For example, there's things like, very few promotional opportunities, and there's a high turnover rate. And, even such physical things as computers and an adequate phone system we don't have. And I'm wondering what can be done at the different levels of government to work on that issue, how to make the different levels of community more responsible for the issues of abuse and neglect, and how to cut down on the helper bashing that's so prevalent.
I think that's yours, Linda.
God, I feel like I'm in an area office visit. Obviously, you know as well as I do, these are the things that I struggle with every single day. And when you go to the state legislature or the media, they don't want to hear about the fact that when you go to court with an adoption record, you got to have 4 copies of it, and I don't have any clerks, and so rather than having social workers or lawyers standing at photocopy machines all day, I wanted to get contracts for each office with like a copy cop, in order to just have pickup and delivery service for case records. And the price tag on that's $2 million. Well, where do you find $2 million in order to do that kind of stuff? Or that in a state like Massachusetts, you got to go back to the legislature if you want to get money for promotions, or you got to find it someplace. What we've been working with the federal government on, and actually it's come down to more of a state issue than a state policy issue more than anything else, is that by my way of thinking, if I can help to maximize the revenue that I get from the federal government through our 4E accounts, which is money we get for kids in foster care, or money we get in for preventive services, or money we get in from daycare, money we get in from Medicaid, if I can show the state that I can reduce my what's called net state cost to the citizens of the Commonwealth by bringing in more federal revenue, I'd like to keep some of that for the department in order to vest in things like more workers and promotional opportunities and phone systems and Xerox machines and computers and all of that. And to date, although the governor has been supportive of that, the legislature has said, well, that's great that you're bringing in more money. We think it's fabulous, and next year we want you to bring in $30 million on top of that, but it's all coming into the state treasury. And so that's an enormous frustration. But at the same time, then you get beat up by, as you said, by the press and everybody else for not doing not doing the work at hand. And just, I'll take one more second. The thing that it has finally struck me is that people who are often very conservative on children's issues and say, these are poor, awful people, perhaps they're living in homeless shelters, why don't you take a van over there and pick up all their children and put them in orphanages, are the same, oftentimes the very same people who think that you shouldn't invest money in children's services.
Okay.
Hi, my name is John Simon. I'm a first-year master's student here, and I'd like to thank the panel on a very illuminating discussion and echo Mr. Latimer's sentiments that we have to get on with the discussion. What I'm wondering is, Assistant Secretary Bain said, government can't possibly meet all the needs of the community, but there are resources in the community that can meet the needs of people. And I'm wondering, if government assumes some of the responsibility for people, do they disempower those resources that could be serving the people in the community? And I have a second question, which is that your successor at New York's Commissioner of Social Services, I heard him once say that what government should move to in terms of providing social services is away from providing them and towards something like a Medicaid managed care capitation for other social services, and that they should pay up front to a provider to say, you provide all these services, you're in the community already. And if that's a solution to move government's role away from the actual doing and towards more of the providing some of the equity.
Your first question, can government dispower or displace? Yeah. Does that mean you don't want government, or you shouldn't be trying to figure out ways of sharing responsibility? I think no. I think that government is one of the major instruments we have to carry out our collective purposes, and we entrust it with that responsibility. But I think that we do need to be very aware and very careful that governmental institutions are supportive and are providing leadership in ways that mobilize the whole community. The second point about ways of doing things differently, I think, is absolutely right and very important, and it's very important that we have as much kind of flexibility and innovation and demonstration as we can. There's actually an interesting example in the child welfare services area, which is that one of the perversities of the way the child welfare system works, and Linda probably knows this better than anybody else, is that the federal government will provide unlimited money to support children in foster care, but very, very little money. The $1.50 that Linda was talking about in family preservation and support, it's a little more than that, but no, it's not a lot more. For preventive services and services to keep children together, and you sort of think about that. And let me think about this now. We're going to provide unlimited money for kids in foster care and no money for kids in preventive services. Surely that can't be the right answer. And surely it isn't. Just this last Congress, in one of their last gasps, Congress actually passed a demonstration authority so that we'll be able to allow 10 states or 10 somethings to do demonstrations where they put the money together and use money that they would have used for foster care to provide other kinds of services. And I think that will allow some interesting kinds of experimentations, and is one of the things that yeah, sign here. Just don't tell me how you're claiming other money. But I think those are exactly the kinds of things that you need to try to devise in order to bring some of these things together.
Can I add one more thing on that? I just want to try something in Massachusetts that's along those lines, which is that if you look at the way that care is funded, the incentive is to keep kids in the highest rate placements, structured foster care systems that you can. So what I'm trying to do is to say to a private agency, look, I'll give you $3,000 a month, the managed care model, I'll give you $3,000 a month to take care of this kid rather than $1.50 for each day they're in this bed, and you do whatever it takes and wrap whatever services it is, and if you can get them home with counseling services, which is pretty cheap, or a visiting nurse, mazel tov, I'll still pay you that amount of money.
And Mary Jo's successor, Mike Dowling, we just found out will be here Monday visiting. So as soon as we get a schedule, we'll post it for those of you who might want to talk to him.
Good evening. My name is John Edson, and I'm a second-year student here. And I was hoping that we could talk a little bit about what the Clinton administration's response will be, or should be, to the Republican proposals that may come out on welfare reform. And as you may know, you're speaking to a bunch of policy wonks at the Kennedy School, and if it comes to a proposal where the Republicans advocate removing welfare grants altogether to certain groups of individuals, very draconian cuts, I would like to offer a proposal and get your reaction to that of what I think how Clinton could respond. Well, like every idea, you need to have a catchy political slogan, and I would call this childfare, not welfare. And as a liberal, what most people really cared about most, I believe, in the 60s, our number one concern were poor children. Because whether you're liberal or conservative, you have to agree that those individuals are not responsible for what the actions of their parents. But if you take the conservative approach, you're really not addressing what happens to them. Even if it's a 2-year cutoff, as Clinton's proposing, or if it's a complete cutoff no matter what, as Gingrich proposes for people 21 and younger, those people will be the ones that will be hurt. Now, if it comes down to a choice of giving up everything or protecting those children, I think the number one priority is protecting those children. And if you could devise a system where you provide aid to people 18 years and younger directly, you really address those children's needs without the arguments that conservatives bring up of disincentives to the parents. And you could do that through the schools. You already provide school lunches and school breakfasts. There's a low marginal cost to providing dinners as well, and direct health care benefits through the school tied to attendance. And something like that, if it came to an alternative of losing everything, at least you're protecting the children.
Yeah. Predicting the politics of welfare reform in this next 6 months is something that I don't feel like I have the capacity to do. I threatened to turn all questions on welfare reform over to Al Carnesale, but he claims he won't answer them. I continue in my naively optimistic way to believe that there are a set of principles which the American public and their elected representatives actually believe in. They believe in the principle of care and protection of children and of not throwing kids out in the cold. But at the same time, they believe that adults who are inevitably tied up with children in the units that they live in ought to work, ought to prepare themselves for work, ought to take as much responsibility as they can for those children. And the dilemma of the welfare system has always been, since the first day of the welfare system, how to keep those two things going along together, to support the values that we all hold dear, about work, about responsibility, about care for children within a system that meets all those values. We in the administration struggled real hard to come up with a proposal that I think does embody those values. There are other things. I know that there are other ways to approach that, and I think we will be struggling hard over the next 6 months or a year to see if we can't come up with something that meets those values. But as I say, I continue to be optimistic that deep in our souls we do cherish those values, and that we will in fact be able to work something out. Tom?
My name is Tom Longstreth. I'm first year at the Masters also. I'd like to get back to the first question, Julie, that you asked, non-targeted programs. And I see two that have been, why don't I just say, I see two of them that are fairly large, one being Social Security and the second being public schools. People would argue probably how successful each has been. Definitely Social Security has alleviated some poverty, and schools certainly educate more than they would if they didn't exist. But I'm curious what specifically, what other programs any of you see that we could really expand that model on?
Let me give you a few examples of why I think we've gotten into trouble by over-targeting. There was a time that public housing, and if you listen to Jesse Jackson tell the story about when he and his family first moved into public housing, and it was a move up for him, and how there was a school teacher in the project, and and the school teacher knew his mother, and therefore he couldn't lie about what he did in school. And he tells this marvelous story. Well, what he was saying was, there was a time when public housing had a sense of community, and it was reasonably sure we aimed it for people of lesser means. But New York City had one of the great public housing in America for many, many years because it was not so targeted. Now, as a result of a lot of well-meaning changes, we've pushed it further and further down. In 1967, when the law was first changed, the median income of a public housing family was in a range of 55 to 60% of median. And it's gone down steadily. Today, it is 17% of median. 17% of median. Most of the overconcentrations of poor people in stacked up public housing right now in America is where the great distress and disaster and tragedy is for poor kids to be growing up in that kind of environment. And Secretary Cisneros is recommending several important changes in which someone who gets a job will have a moratorium for 18 months, because we know that getting a job is merely the first step. Have a moratorium for 18 months before the rent will rise. And secondly, when it does rise, it won't rise without limit. And he drew this from an experience when he saw literally families being broken up as a result of the public housing rules and as a result of people, the disincentive to work. And so the whole Clinton thrust to make work pay is, I think, a central ethic of American life. And that's everything that we look at, every program should be measured. And I don't pretend to be able to measure out every program, but that's one good example that we're supporting to change rent rules. A second example is in assisted housing. He is now proposing that we use some of the revenues for assisted housing is basically publicly subsidized housing, but outside of public housing and managed by private sector. And our Inspector General estimated about 1/3 of the assisted housing units in America are distressed. And so what we're recommending is that some of the revenues from that go to developing support systems and social support systems, community policing, and the rest, so that assisted housing can have some of the community glue that well-run public housing authorities presently have. There are probably other examples. There are, incidentally, I'd like to press ahead a little bit on, we once did an examination of daycare in St. Paul and Ramsey County, and the fact is that we really did have a graduated system, but we didn't call it that. Yeah. It was unorganized, but it was graduated. So that some people were paying $10,000, and some people were getting it paid by welfare. And so it's that, I'm not suggesting that we have resources that are so expansive as to de-target everything, but I am suggesting that real public-private participation at the local level can start erasing those differences and embracing broad community support systems that don't pigeonhole poor people and put them out of the way of the rest of society.
I think we have time for one more question.
Okay, thank you. My name is Kimberly Gates, and I'm a first-year Master's in Public Policy student here at the Kennedy School. This question is for you, Ms. Bain. I am from Southern California, and I was working for the Centers for Disease Control and working with them at a health department in Long Beach. And the referendum that passed 2.5 weeks ago, 187, has me very concerned, particularly about the health and social services, not only of illegal alien families and children, but also the larger community, because health departments do immunizations, TB screenings, and various other services. So I'm sort of curious to know, what type of effect do you think that 187 will have on that community in addition to the larger community? And the second question would be, and this is actually for everyone, what does this tell us about our community's priorities, values, and principles? Is there a shift in what people find are important, and possibly are they not thinking that families, children, women are important by their response with 187 and other types of legislation?
I mean, I think everybody's very worried about the potential impacts of 187 and what that will mean indeed in terms of communities and in terms of children. I mean, it won't go into effect for a while. It will be in the courts, I suspect, for a long period of time, and one would expect that the courts would be consistent with their earlier rulings, but you can never exactly predict that. I suppose what kind of is going to need a lot of thinking in this area over the next couple of years is the larger set of questions and how we deal with those. I mean, the fact that there obviously is a lot of anger in certain communities about perceptions that people who are not citizens are getting things when people who are citizens are struggling and feeling insecure themselves, and a combination of responses which says we do in fact need to protect our borders, we do in fact need to do the best we can on ensuring that legal immigrants are welcomed and cherished, but that we do have some rules and that we need to enforce those, but also to be realistic about the fact that when you deprive a part of the residents of your country of essential services, especially health services, you can really be shooting yourself in the foot. And I think that's the struggle that the people of California were speaking to and that we're all going to need to be dealing with.
I'm not inclined to be dismissive of people who are struggling with this issue, nor am I at all inclined to conclude that our values have diminished and we're now hardened to the need of children who happen to be children of illegal immigrants. Xenophobia and all of its byplay has really been with us forever. And when the economic pressures are on, as they have been in California, the county of Los Angeles has the largest population of any county in America coming to it every day, and the largest population leaving it every day of any county in America. So you're talking about a place that is filled with extraordinary tension and turbulence. And this is not to justify something that I would oppose, but I simply want to put it. Remember that in Korematsu against the United States 50 years ago, our Supreme Court said it was all right to incarcerate Japanese. And for 100 years, I mean, I know this is all too familiar, but for 100 years, slavery was considered essential to the economy of a large part of this country. So I'm not trying to flagellate ourselves as American. I'm simply saying that 187 is simply the latest iteration in what has been a centuries-long struggle that we're having between our humane impulses and a sense of fear when all confusion takes over. And I do think that the real solution is going to be a combination. I'm convinced that Mary Jo is right, that Americans and Californians will not abide the inhumane neglect of the children. They just won't let it happen when they see it. To vote for something out of anger is one thing, but to see a child literally abandoned is something we will not countenance, nor will people in California. I'm convinced of that. But beyond that, I think that NAFTA and the supporting the development of much of Mexico as possible is going to be ultimately the best thing we can do for peace and stability throughout that area. And I think that opening up other areas, you know, in St. Paul, Minnesota, 1 out of 4 Irish Catholic St. Paul, we always called it. I'm half English, but I never let anybody know that in St. Paul because they think I'm Lebanese, which I am, but that's exotic, though. Permit that. But what I'm trying to say is that it's a small Boston, St. Paul is. 1 out of 4 of our elementary school kids are Hmong. 1 out of 4 are Hmong. So this is not just California. I mean, this is Southeast Asians, basically incredible tribal people from the hills of Laos, who I think finally are going to make St. Paul and Minnesota a richer place than it ever would have been. To dilute some of the Swedes and the Lutherans can only can only improve things. So, but to be really serious, we really have to be, number one, careful not to quickly dismiss and paint into camps one side or the other on that. Secondly, look at the larger picture of the relationship between the economies of the two countries. Thirdly, be really serious about supporting stronger measures to support the Attorney General's recommendations for stronger measures to prevent, where possible, illegal entry. And it'll be that combination, I think. And finally, the numbers of people who are coming from diverse backgrounds are going to become so apparent to this country that we're going to start acting the way we always dreamed that we would act, because it will be essential to our survival. I went on a little bit long, but this is a rather powerful point you raised. Another story to borrow now. Today, and I'm sorry I cannot give proper credit to the host, who was a retired head of the Federal Reserve here. Yeah, Bill Edgerly hosted this Federal Reserve meeting today in Boston, in which they presented findings about the terrible erosion in central cities, but the hope that community-based organizations and a commitment of banks to join with them can make a difference in central cities. And what he said was that these tall buildings surrounding us in Boston are going to be peopled by people of color by the turn of this century and not very far beyond that. And therefore, it is essential to our very survival as a people. This is what this banker said. And I find that extraordinary, that a person can speak for a strong private sector in Boston with that kind of enlightened awareness. And I think that's where we're going to be moving in California and in the Eastern Seaboard and everywhere in this country.
Thank you.
Thank you. I'd like to thank our panel, Mary Jo, George, and Linda. I've never heard it so eloquently expressed. That was well done.